Hello, everyone. We are Group 11, and this is our second value proposition for our intra-blood-brain barrier glutamate monitor and anti-epileptic drug delivery system. We chose to design a device to improve the diagnosis and treatment of epilepsy. Epilepsy is characterized by excessive and uncontrolled electrical activity in the brain, which is manifested as seizures. You can see from this list that its etiology is quite varied, making precise diagnosis and appropriately tailored treatment significant clinical challenges. Not only is it worth investigating to improve the health and quality of life of these individuals, but it has significant social and economic impacts. Epilepsy affects people of all ages, races, and genders, and according to the WHO, about 50 million people suffer from epilepsy worldwide, with about 3.4 million of those in the United States. Unfortunately, despite its prevalence and long history of clinical research, there is no cure for epilepsy, so treatment is focused on minimizing seizure activity, usually with daily medications. But more unfortunately still is that these medications are not effective for about 1/3 of patients.
Our approach will use glutamate as a biomarker due to its increased levels in epileptic patients. Our device is a sensor that will continuously monitor the concentration of glutamate. When an increase is detected, a drug delivery system, or DDS, will trigger the release of a drug to increase GABA, a neurotransmitter that aids in preventing seizures. Therefore, this continuous and automated system will decrease uncontrollable and irregular seizures. The sensor is implanted in the brain and manufactured with a Clark platinum electrode that utilizes glutamate oxidase to indirectly measure glutamate levels by its breakdown products. The dimensions are 30 by 5 millimeters and 78 micrometers thick. The sensor is 3D printed using a sterilizable and biocompatible conductive polymer called P.PSS, which is flexible and puts minimal mechanical strain on the tissue. The sensor is first implanted for 30 days without the DDS to continuously monitor the patient's glutamate levels and determine the glutamate threshold. The data is transmitted to a receiver for interpretation externally. After 30 days, the DDS is placed on the arm. It receives the information from the sensor and is programmed to detect the glutamate threshold. At threshold, it mechanically triggers the release of 1 milligram dose of clonazepam to increase GABA production and prevent seizure onset. The dimensions are 3.8 by 2.5 centimeters in size with a thickness of 1.3 centimeters. The DDS has a drug-releasing needle inserted into the skin. The drug-carrying pod is an external attachment constructed of 3D printed polymers. 3 milligrams of clonazepam is loaded into the pod and refilled as needed by self-injecting the drug into the port on the pod using a syringe. The device is sealed to the arm using a waterproof hypoallergenic adhesive so the needle stays in place. Finally, the external design has a dosage status light that turns on when the clonazepam needs to be refilled and an injector status light that turns on when clonazepam is being released into the body.
The first value aspect of this project is that it provides the patient with clonazepam, which is necessary to suppress seizures. An individual cannot detect a glutamate increase on their own, so an implanted sensor can deliver medications prior to the onset of a seizure. This improves quality of life for the patient, making it something they do not have to think about. Much like an insulin pump, the device would detect the problem within the body and send a response to help correct it. Another valuable aspect is the data that it provides for future research by recording glutamate levels over time. This can allow for further correlations to be made regarding the onset of seizures and daily activities. Ideally, the cost of research and development will be covered by a medical device company. Currently, sophisticated and complex sensors that are implanted in other areas of the body cost less than $20 to produce using batch fabrication techniques. Also, once approved, this device and associated surgery will be covered by insurance. For patients with health insurance, the typical cost of brain surgery would include doctor copays and coinsurance of 10 to 50% and likely reach the patient's yearly out-of-pocket maximum. For patients not covered by health insurance, surgery can range from $50,000 to $150,000. The patient would also need to pay for the drug being administered. Clonazepam costs anywhere from 30 cents to $1 per pill, depending on dosage.
There are several nerve stimulation devices currently on the market for treatment of drug-resistant epilepsy. The three most common of these devices include vagus nerve stimulation, responsive neurostimulation, and deep brain stimulation, which all act as pacemaker systems for the brain. Glutamate receptors are also a market competition for our design. A product currently in development is a 3D printed biosensor. This device is meant to be implanted into the spinal cord to read for extracellular glutamate concentrations. The drawbacks of this design are first, that implementation into the spinal cord limits real-time readings of the brain where seizures originate. And two, this device only collects information on glutamate concentrations while doing nothing to actually improve them.
Thank you, and we look forward to hearing your feedback.